So one of the challenges we have these days in designing emergency departments especially is the need to balance behavioral health environments with the patient care that goes on, even when there's no behavioral health patient in there. So instead of building garage doors and hiding the services and having the cost of all of that construction, not to mention the encroachment in the room by those hidden panels, we've developed a cart that will allow you to bring all of the essential services required for a general patient care environment. Everything from suction and oxygen and all your PPE and sharps containers and all the other things required in general, even exam lighting, vital signs monitors, diagnostic instruments. So any room, even an empty room, can function now as a standard exam room. And when you have a behavioral health patient come in, all you need to do is take this cart, unplug it from a single outlet in the wall, from electrical outlet, or everything's battery operated as well, and just remove the cart from the room. And then you have an empty room that you can now place your behavioral health patient into without any construction, without any noise of closing a garage door, nor do you have a risk of somebody banging on the door or damaging that which is in the room. So very easy to deploy, very easy to take out. A complete forward triage system that can also be used in some other aspects for non-traditional care later on. So as we've just brought our cart out of the behavioral health room, we can now deploy it to any alternate care site or non-traditional care location. Again, we are completely self-contained with diagnostic instruments, with sharps containers, also the oxygen tank system. We have vacuum, we have all additional PPE back here, but we can actually serve a ventilator patient with this high-capacity oxygen system that we have on the cart. Once we get it in place, all we do is move it to a location that's convenient. Again, where that might be, it's completely up to the demand of the environment. It could be a hallway, it could be a lobby, it can be an off-site center, but this is completely self-contained. Again, as a clinician myself, I'm really hyper aware of the PPE at the point of care. We can't be walking away from our patients when we look for PPE. We have a sharps in our hand. We need to be able to dispose of it at the point of care without having to go search for a sharps container. This Paladin Forward Triage cart does exactly that and is the optimum scenario for alternate care site patient care in any kind of scenario.